Are you frustrated that your doctor visits are shorter than you'd like? Well, it may not be your doctor's fault because doctors are drowning in paperwork and they're unhappy that it cuts into their time with you. Now, electronic medical records are not turning out to be what they were cracked up to be, and doctor morale is at an all-time low. And your doctor prefers to examine and talk to you about your health issues rather than doing extensive computer and paperwork. So we're going to be talking about electronic medical records and what they're doing to healthcare and how they do affect the doctors.
Yeah, in theory, it sounds like a wonderful thing. Who wouldn't want to have access to your medical records in an instant? Just push a button, you've got it, from the hospital, from other doctors, from other laboratories, from all kinds of places. It's a beautiful concept. And if it were used just for that concept, it would be terrific. But the problem is that electronic medical records are being used by insurance companies. They're being used by the government, particularly by Medicare. And a lot of those records are going where? Homeland Security, IRS, and other organizations. And it's a way of tracking doctors to see what they're doing.
And the doctors have to prove that there's a reason to treat you the way that they want to treat you.
If it's not an approved approach.
And it has to be approved and according to their rules.
That's right.
And so that if you don't go along with their rules, then you can get in trouble.
You get into a lot of trouble. Because what will happen? First, they'll tell you you can't get paid for the service through Medicare that you're providing. Second, they'll make sure that the patients know what's happening. Then they'll fine you if you continue to do it. And then they'll take your license away. And if that doesn't do it and you keep doing it, they'll put you in jail because they call that medical fraud.
But you can see, too, that it's sort of set up to look like they're trying to protect you from an incompetent doctor.
And there are some incompetent doctors that you do need protection from.
But the government is also acting like an insurance company, and they're acting like a doctor.
Well, more...
Because it limits what you can do with your patients.
Exactly. Let me give you a case in point. In my practice, I use infrared light therapy, and I use it to treat people with lots of different kinds of pain, but in particular, diabetics with neuropathy. Why do I do that? Because I've had 15 years of experience, and we've done a clinical trial to back up what we do, and I know that in about 10 minutes of infrared light treatment, that we can reverse a lot of people who have mild to moderate pain of diabetic neuropathy, some of the numbness, and improve their balance. I know that. However, the government doesn't know that, or at least they say they don't know that, because there are no reimbursement codes for it. So I have to charge my patient out of the Medicare plan for the services that I provide. And if I try to charge for Medicare for those services, that's fraud. So now the plot thickens. It's not just that the government is wanting to make it easy for doctors and for patients to get their records. It's because that's how they patrol what you do. And as that becomes more and more involved and more common, because most people are working either for Medicare or for government insurance or for some big HMO, and what they do is no longer at what their choices are.
The doctors are becoming like puppets.
They have become puppets. We knew that in 1990.
With HMOs.
Exactly. And I warned my colleagues, I said, don't sell your practices to the hospitals. Don't join the big HMOs. Don't worry. What we should be doing is organizing some kind of union for doctors. It's a true union, so we can do some bargaining against these big companies and go back to private practice. Because otherwise, you're working for somebody else. They're telling what you can and can't do. They can put you out of business in an instant by firing you. You have no patience, and you can be prosecuted for some of the things that you're doing because they call it fraud.
Plus, they thought they were going to have less paperwork.
Oh, right. And now there's more paperwork, and doctors are going insane.
So what's with all this paperwork?
Well, it's not just, we're not talking just about paperwork to make medical records right or to do things that are related to talking to other doctors or to get laboratory work. This is about doing paperwork about the business of medicine or what's going to happen to your particular job if things change.
But what's the paperwork that the doctors are doing? Like they're doing codes?
Oh,
and what else are they doing?
Just all kinds of business things that have to do with their practice rather than have to do with patient care. So when we see that happening, we know that this has become a business more than it's becoming a service for patients. So, are electronic records, medical records, a good idea? I don't think so if we look at the whole package. If we could do it in an honest way that allowed doctors to be able to use it for the good things about it, that'd be terrific. But that's not what's happening.
It's about control.
It's about control. So, here we are.
Because, see, the other thing is that you talk about patient-centered care all the time. So this is taking away from individualizing a patient.
Absolutely.
Because each patient is a little bit different.
Exactly.
And you might treat the same condition, but just a little bit differently. But according to what the government is setting up, if a person has blood pressure, you treat them this way. If they have heart disease, you treat them that way.
Right.
Everything has its own
Exactly.
list of rules of what to do instead of individualizing.
Right. So if you want to do something different, you have to get pre-authorization. So doctors are spending a lot of time on the telephone, answering questions from people who aren't doctors at all, and listening to how these people are telling us what we can and can't do. That's why I will never be a doctor who works for a large company or works for the government. I'm going to do it my own way, the way I know is what my patients need.
And you can be creative.
Very creative. And I think we have a practice that serves people in a way that few practices can. So we have to take the initiative to do what we know is right. And maybe at some point in time, doctors will get it through their heads that they need to join in a world like today into an organization that can take care of its needs. That's called a union. If we do that, we'll take back some of the control that we've given away because we didn't want to manage the purse strings of medicine.